We would advise you to come for spotting. Obviously, what we would say just to ring first, like that. Sometimes it can be spotting that's for different reasons. So if it's bleeding, really, you should come to the hospital at any stage in your pregnancy, for assessment. Usually we would say to visit your GP first, because that's your first line. He or she would usually give you some antibiotics. If the urinary tract infection develops and you end up being very unwell, like having a temperature or feeling very unwell with your urinary tract infection, we would advise you to come to the hospital then. If you can't get an appointment with your GP, obviously you can come to the emergency room, but we would try with everything. We're trying to keep people away from the emergency room and try to kind of get people to come if it is a real emergency. So first thing would be to go to your GP first, get your urine checked. Your GP will do a full assessment to see if you have a urinary tract infection, usually give you an antibiotic and it should resolve. But if your symptoms, if you have any severe pain or temperature, it might be a little bit worse than just a normal urinary tract infection. So we would advise you to come to the hospital for them reasons. Well, if you have symptoms of preeclampsia, which would be if you're at home and you can't check your blood pressure, you would have a headache, some blur vision, maybe seeing some stars, and epigastric pain, which is pain across the top of your tummy. So usually what we would say, if you ring with these symptoms, we would always advise you to get your blood pressure checked first. If your blood pressure is normal, well then it could be something else, your blood pressure and your urine. If your blood pressure is elevated and you have protein in your urine, we would definitely advise you to come to the hospital. Definitely preterm labour would be something we'd say to come straight to the hospital. But if you've from 24 to 37 weeks, if you have regular uterine contractions, in a regular pattern really is the most important thing with these. Sometimes people come in and they think, 32, 34 weeks, they think they may be in labour, but they'll say, well, they've stopped now, or, so what we say, if they're in a regular pattern, and if the pains are increasing and they're not going away, sometimes people have Braxton Hicks contractions, which can kind of last for a few hours, start a few hours later. They can be Braxton Hicks, which can be sometimes painful. And you might think that it is threatened premature labour. But, we would say to people, take some paracetamol, get some rest. If the pains are increasing and persistently, and each one is getting closer and closer together and lasting for longer, you should really come to the hospital. And then for labour, we would say for over 37 weeks, we would say when your contractions are every 4 to 5 minutes, lasting over a minute, and when you're distressed with the pains, or if your waters go, you need to come to the hospital. Let's say if you get injured while you're pregnant, let's say for a road traffic accident or something like that, we would have people coming in who've fallen. Usually they're worried, obviously if they're well enough to make it to the emergency department, they're worried about the pregnancy. So we would say, firstly, if you're worried, you should probably go to a general hospital about yourself, but sometimes we would have people come and we will assess them, do a scan of their baby, do a CTG, which is a trace of their baby's heart rate, just to make sure their baby's okay, do a scan and refer them to a general emergency department. We don't see, we have people in broken shoulders, stuff like that, broken arms, broken legs. They generally tend to worry about the baby first, which probably they shouldn't, but it's maternal instinct, I suppose, to come and check the baby. So what we would say to you is, first go check in a general emergency department, and then they will say to you, you need to go and check the baby next. So we always have referrals from the Mater or Beaumont or other hospitals just to check the baby afterwards. So. Yeah, well, that's probably our most important presentation to the emergency room. We would always tell anybody who's worried about their movements to come to the department. Usually when people ring the phone, they'd say, maybe I've reduced fetal movement since this morning. It could be lunchtime. What we would say usually is take something to eat, something sugary, something, cold, a cold drink, take a bit of time out of your day. Put your 2 hands on your tummy, lying on your left side, put your 2 hands on your tummy and assess your movements for about, maybe an hour, if you can. If you're not happy with your movements after that, you should present to the emergency department. It's the one presentation that we would always tell people to come with. If you're concerned about your pattern, really, sometimes people, they go on Google and Google will say you should have 10 movements an hour, which is very incorrect. We would have a lot of people coming in worried like that oh, Google said this or that. But usually it's your baby's pattern that we worry about. It's the pattern over the full day. You know, if you're worried, you know, some people have 10 movements a day, some people have 100 movements a day. Some people maybe are quieter than others, they're quieter in the evening, they're busy in the morning. You know, it's your pattern really, and it's what your perception of it is. So if you're worried, you just pick up the phone or present to the emergency room. It's the one thing I would say just to come if you're concerned with.